Hi everyone, this is Dr. Akhtar. Today I will talk about my second lecture of pelvis perineum. For your convenience, I divided this lecture into two sections. In the first section, I will talk about the pelvic part of the peritoneum, and also I will talk about the rectum, anal canal, and female internal genital organs. And in my second part of lecture, I will talk about the male internal genital organs and urinary bladder and urethra. So let's start. The peritoneum, the parietal layer of the peritoneum, you have seen on the internal side of the anterior abdominal wall. So this is the interior view or the internal surface of the anterior abdominal wall. So if we look at from inside the anterior abdominal wall, you can see this membrane over the anterior abdominal wall is the peritoneum. And the peritoneum reflects over the anterior abdominal wall. It raises some folds below the umbilicus, and these folds are raised by some of the embryonic structures. So these folds, there is one median umbilical fold, and then on each side there are two medial umbilical folds. See the two medial umbilical folds, and then two lateral umbilical folds. These umbilical folds are formed by the parietal peritoneum, but underlying these folds there are some structures which raises these folds. The median umbilical fold is raised by an embryonic structure which is called urachus. The medial umbilical fold is raised by the obliterated umbilical artery, and the two lateral umbilical folds on each side is raised by the underlying inferior epigastric arteries and veins, inferior epigastric vessels that raises the lateral umbilical fold. The peritoneum covers the anterior abdominal wall, and then it covers the pelvic organs. See, behind the pubis, this is the urinary bladder. So peritoneum reflects over the pelvic organs. It never reaches up to the pelvic diaphragm or up to the pelvic outlet. It goes over the pelvic organs. And it differs in male and female pelvic cavity. So this is the peritoneum of the male pelvic cavity. See, this is urinary bladder. The urinary bladder, which lies behind the pubis. So in this image, you can see this is the sagittal section, one of the mid-sagittal section. And in the mid-sagittal section, this is pubis. And behind the pubis, the very first organ is the urinary bladder. So peritoneum reflects from the anterior abdominal wall. It covers the superior surface of the urinary bladder, and then it descends a little bit of the posterior aspect of the urinary bladder, which we call the fundus of the urinary bladder, and then it goes up anterior to the rectum, and it covers the upper part of the anterior surface of the rectum. And in between the urinary bladder and the rectum, this peritoneal space in the male pelvic cavity is called rectovesical pouch. Vesicle means urinary bladder. So this space, peritoneal space in between the rectum and the urinary bladder is called rectovesical pouch. So here you can see this is the superior view of the pelvic cavity. So you can see that from the anterior abdominal wall, the peritoneum covers the superior surface of the urinary bladder. Then it descends a little bit over the posterior aspect of the bladder. Then it covers the anterior aspect of the rectum. And this space, peritoneal space in between the bladder and the rectum is the rectovesical pouch. So in case of male, this space is called rectovesical pouch. And in the female, it is different. In the female, in between the urinary bladder and the rectum, in the pelvic cavity, there is uterus. The uterus lies in between the urinary bladder and the rectum. So in case of female, the peritoneum covers the superior surface of the urinary bladder. Then it goes over the uterus. So here in the sagittal section, you can see peritoneum goes from the anterior abdominal wall over the urinary bladder. Then it goes over the anterior surface of the uterus, the body and fundus of the uterus. It covers the superior aspect of the uterus, and then it covers the posterior surface of the uterus, and it goes all the way down here, and then it goes up over the rectum. So in case of female, the uterus lies in between the urinary bladder and the rectum. So the peritoneum, it creates two peritoneal spaces in the female pelvic cavity. The peritoneal space in between the urinary bladder and the uterus is called vesico-uterine pouch. Vesico-uterine pouch in between the bladder and the uterus. And in between the rectum and the uterus, this space is called recto-uterine pouch. In between the rectum and the uterus is the recto-uterine pouch. And recto-uterine pouch is deeper than the vesico-uterine pouch. You can see it goes more inferiorly. And this recto-uterine pouch is clinically important, and clinician they call this also pouch of Douglas. And in the female also, you can see the peritoneum covers the uterus, it covers the ovaries and uterine tubes and everything. And uterine tubes in the female peritoneal cavity, see, in the female peritoneal cavity, the uterine tube has openings. Uterine tubes has opening inside the peritoneal cavity. So female peritoneal cavity is an open cavity, but male peritoneal cavity is a closed cavity. The rectum means straight, but usually, normally the rectum is not straight. It is one of the terminal part of the digestive tract. It continues superiorly with the sigmoid colon. The sigmoid colon and the rectum junction is in front of the third sacral vertebra. So in front of the third sacral vertebra, the sigmoid colon ends and the rectum begins, and we call this recto-sigmoid junction. And the rectum, see the rectum, it lies in front of the sacrum. From the third sacral vertebra, the rectum begins, and then it goes down, and below it is continuous with the anal canal. And the rectum, so you can see here, this is male pelvic cavity. So you can see the peritoneum, it goes over the urinary bladder. It goes over the urinary bladder, and then it forms the rectovesical pouch. This is the rectovesical pouch. And then it covers the anterior surface of the middle 1/3 of the rectum. So see, the rectum is covered by the peritoneum anteriorly in its middle 1/3, and its superior 1/3, the peritoneum covers both the anterior and lateral surfaces. Then the peritoneum is covering the sigmoid colon, and on the sigmoid colon it forms the sigmoid mesocolon, which is the mesentery for the sigmoid colon. So the superior 1/3 and the middle 1/3 of the rectum is covered by the peritoneum on its anterior aspect, and a little bit of the lateral aspect. But inferior 1/3 of the rectum is subperitoneal. It is underneath the peritoneum. So all this part of the pelvic organs, the urinary bladder, this part of the rectum, and also the male internal genital organs, the prostate, seminal gland, all these are underneath the peritoneum. So peritoneum does not go all the way up to the end of the pelvic cavity or the pelvic outlet. So rectum, it ends at the anal canal right here. Anal canal is the most narrow part, and the rectum, it goes through the pelvic diaphragm muscle, and it lies in front of the sacrum and the coccyx. The sacrum and the tip of the coccyx lies posteriorly, and in the female pelvic cavity, the anterior relation of the rectum is the cervix of the uterus and also the vagina. And in case of male, on the anterior side of the rectum, the prostate, which lies in the neck of the urinary bladder, the seminal gland, seminal gland, prostate, and the ampulla of the ductus deferens. These organs are related anteriorly to the rectum in case of male. The rectal digital examination is performed by the physician, and by rectal digital examination, we can palpate the prostate or any enlargement of the prostate. In the female, we can also palpate the cervix of the uterus, and also we can palpate any cancer masses or any enlarged lymph nodes through the rectal digital examination. So here, we cut the rectum longitudinally from the posterior aspect. So see the rectum, it goes through the pelvic diaphragm. See, this is the mid-sagittal section. So see the rectum, the most terminal part of the rectum is dilated, and this dilated part of the rectum is called rectal ampulla. And rectum bends a little bit. First it bends towards the right, then towards the left. And inside the rectum there are transverse folds, transverse rectal folds. So the terminal distal part of the rectal ampulla, which is continuous with the narrow anal canal, and the recto-anorectal junction is this one. This is the anorectal junction. So you can see the rectum, rectal ampulla, and then abruptly it becomes narrow, and it passes through the pelvic diaphragm, which closes the pelvic outlet, and it becomes narrow and it forms the anal canal. And this angle in between the rectum and the anal canal is called anorectal flexure. Anorectal flexure, and this angle is approximately 80 degrees. And at this junction of the rectum and the anal canal, these pelvic diaphragm muscles, see, in my previous lecture I showed you the pelvic diaphragm is formed by the levator ani muscle. See, the levator ani muscle arises from the tendinous arc over the fascia covering obturator internus muscle. Obturator internus muscle, it forms the lateral wall of the pelvic cavity, and from the lateral wall of the pelvic cavity the levator ani muscle arises, and from the both sides the levator ani muscle goes downwards, and levator ani muscle inferiorly it descends, and from the both sides they fuses with the external anal sphincter muscle. They fuses with the external anal sphincter muscle, and this sling-like levator ani muscle, it helps in maintaining this anorectal flexure, or the bending in between the rectum and the anal canal. Anal canal is the narrowest part, and also this is the most terminal part of the digestive system. Anal canal, inside the anal canal, in its upper part, it has some longitudinal mucosal ridges, which we call the anal columns. Inside the anal canal there are anal columns. Anal columns inferiorly, they join together and they form these anal valves. These are the anal valves. And the superior to the anal valve there are recesses or pockets, and which call the anal sinuses. So this is a larger view. So you can see these are the anal columns. This is the anal valve, and here above the anal valves is the anal sinuses. So the upper part of the anal canal has the anal columns, anal valves, and anal sinuses. If we draw a line, this line where the anal valve lies, this is called pectinate line. Pectinate line is important junction of the anal canal. It indicates the junction of the different nerve supply. Above this line, above the pectinate line, the anal canal has one type of nerve supply, and below the pectinate line it has another type of nerve supply. And also the developmental origin is different above the pectinate line and below the pectinate line. And also the epithelial lining epithelium is also different. Blood supply, nerve supply, everything is different above and below the pectinate line. So pectinate line is an important junction within the anal canal. So anal canal is surrounded by two sphincters. In my previous lecture, I mentioned already that there are two sphincter muscles surrounding the anal canal. This is the external anal sphincter muscle, and there is another internal anal sphincter muscle. External anal sphincter muscle, which lies externally. And see, in this inside view, you can see this is the anal orifice. Surrounding the anal orifice, this is the external anal sphincter muscle. External anal sphincter muscle, underneath the skin, it has a subcutaneous part, it has a superficial part, and also it has a deep part. Subcutaneous part is underneath the skin, then superficial, then deep part of the external anal sphincter muscle. External anal sphincter muscle is continuous with the levator ani muscle. See, the levator ani muscle is continuous with the external anal sphincter muscle, which forms the medial wall of the ischioanal fossa. Ischioanal fossa lies in this space on each side of the anal canal, in between the anal canal and the ischial tuberosities. So levator ani muscle continuous with the deep part of the external anal sphincter muscle, and this muscle is a skeletal muscle, and it is innervated by the inferior rectal branch of the pudendal nerve, and this muscle is under voluntary control. It controls the movement of the feces through the anal canal during defecation. And there is another sphincter inside, which is inside, that is the internal anal sphincter. Internal anal sphincter muscle is continuous with the circular muscle layer of the rectum. And internal anal sphincter muscle is formed by the smooth muscle, and it is innervated by the autonomic nervous system, and it is not under voluntary control. The external anal sphincter muscle, you can see here, it has also its anterior attachment to the perineal body. So perineal body is the central tendinous point. In my first lecture, I showed you the perineal body receives the insertion or attachments of the different muscles, and also external anal sphincter muscle is inserted or attached to the perineal body anteriorly, and posteriorly it is attached to the anococcygeal ligament, which connects the external anal sphincter muscle with the coccyx. The anal canal, rectum and anal canal is very rich in blood supply. It has 3 sets of arteries and 3 sets of veins. The veins of the anal canal, there is superior rectal vein, middle rectal vein, and the inferior rectal vein. The superior rectal veins draining the upper part of the rectum, upper part of the rectum, and superior rectal vein is draining into the inferior mesenteric vein. Inferior mesenteric vein is draining superiorly into the splenic vein, which is part of the portal venous system. And the middle rectal vein, it drains into the internal iliac vein. See, the internal iliac vein joins with the external iliac vein and forms the common iliac. The right and left common iliac vein joins together and form the inferior vena cava. So middle rectal vein is part of the vena caval system. And inferior rectal vein is draining into the internal pudendal vein. Internal pudendal vein draining into the internal iliac vein, which is also part of the vena caval system. So these anastomosis in between the superior rectal, middle rectal, and the inferior rectal veins, they form a portal and caval anastomosis in the rectum and anal canal. And there are 2 sets of venous plexus. In the anal canal. There is external rectal venous plexus and internal rectal venous plexus. The internal rectal venous plexus is mainly formed by the superior rectal vein, which drains into the portal venous system. And the external rectal venous plexus is mainly formed by the inferior rectal veins, which is part of the vena caval system. So this portal systemic anastomosis, in case of increased pressure into the portal venous system, in case of portal hypertension, these external and internal rectal plexus, these veins get enlarged, and they can give rise the hemorrhoids. So there are 2 types of hemorrhoids. If the hemorrhoids occurs in the external rectal venous plexus, that is called external hemorrhoid. And if the hemorrhoids is in the internal rectal venous plexus, that is called internal hemorrhoids. The external hemorrhoids is externally, and I told you below the pectinate line, this part of the anal canal is supplied by the inferior rectal nerve, which is a branch of the pudendal nerve, that is part of the somatic nervous system. So external hemorrhoids is very painful because of this nerve supply by the inferior rectal branch of the pudendal nerve. But internal hemorrhoids is above the pectinate line, and that gets its nerve supply from the autonomic nerves. And these internal hemorrhoids are less painful because these are supplied by the autonomic nerves. If the external or internal hemorrhoids, it can get prolapsed and it can get strangulated, then it is very much painful. So there are, like the veins, there are three sets of arteries supply the rectum. Superiorly, the superior rectal artery, which is a branch of the inferior mesenteric artery. Then the middle rectal artery. Middle rectal artery is a branch of the internal iliac artery. Then inferior rectal artery. Inferior rectal artery is a branch of the internal pudendal artery. The superior rectal artery supply the upper 1/3 of the rectum. The middle rectal artery supply the lower 2/3 of the rectum. And the inferior rectal artery supply the anal canal and the anal sphincter. So female internal genital organs. Female internal genital organs includes the ovaries, the two ovaries, the uterine tubes, uterus, and the vagina. The ovaries are the almond-shaped reproductive organs. This is the primary sex organ. It produces ovum. It produces ovum or oocyte, and also it produces the female reproductive hormones. The ovaries lies within a fold of peritoneum, which is called the broad ligament, and ovary is connected with the uterus by a ligament that is called ovarian ligament. This ligament is the ovarian ligament. See, the ovarian ligament. And also on its lateral side there is another ligament which is formed by the fold of the peritoneum that contains the ovarian vessels, that is called the suspensory ligament of the ovary. So ovary has two ligaments. On the lateral aspect, the suspensory ligament of the ovary. On the medial side, it is connected with the lateral angle of the uterus by the ovarian ligament. The uterine tube is also called fallopian tube or the oviduct. It is approximately 10 centimeter long. It has two ends. It has a uterine end and it has a infundibular ends. And the infundibular ends has these finger-like projections which are called fimbria. And this end, the fimbriated end of the uterine tube is open inside the peritoneal cavity. And when ovulation takes place, ovum discharges from the ovaries, and then the fimbria catches the ovum and transported through this uterine tube or fallopian tube into the uterus. And also the fertilization takes place inside the uterine tube. The uterine tube has four different parts. The uterine tubes. This part of the uterine tube is called infundibulum. The funnel-shaped end of the uterine tube is called infundibulum. This is the infundibulum, which has the fimbrias, the finger-like projections. And then this widest and dilated part of the uterine tube is called the ampulla. This widest and dilated part, ampullary part of the uterine tube, which is the usual site for the fertilization. Fertilization takes place in the ampullary part of the uterine tube, normal fertilization. Then the narrow, thick part of the uterine tube is the isthmus, and then the uterine tube has opening inside the uterine cavity, and this part of the uterine tube is called uterine part of the uterine tube. The uterus is a pear-shaped organ. The uterus is a pear-shaped organ, triangular shaped. It has a fundus. Fundus if we draw a line connecting the opening of the uterine tubes, above this line, this dome-shaped part of the uterus is the fundus. And then the body of the uterus, and this narrow part which goes inside the vagina, this is the cervix of the uterus. The junction of the body and the cervix of the uterus is called the internal os. And the cervix of the uterus, which projects inside the vagina, and there is another opening inside the vagina, that is called the external os. The uterus is covered anteriorly and posteriorly by the peritoneum. Peritoneum goes over the uterus, and then it forms a fold of peritoneum on the both sides of the uterus. This double fold of peritoneum, which extends from the lateral border of the body and fundus and cervix of the uterus, goes laterally up to the lateral pelvic wall, and this double fold of peritoneum is called broad ligament. Broad ligament has three different parts. The part of the broad ligament, the uppermost part or upper free border of the broad ligament, that contains the uterine tube, and this part of the broad ligament which contains the uterine tube is called mesosalpinx. Salpinx means tube. Mesosalpinx is the small mesentery of the uterine tube. So this part of the broad ligament is the mesosalpinx. The part of the broad ligament which contains the ovary is attached to the broad ligament on the posterior side, and this attachment of the ovaries with the broad ligament, this part of the broad ligament is called mesovarium. So mesovarium is the mesentery of the ovary. And then the rest of the broad ligament is called mesometrium. Metros means uterus. So this is the mesentery of the uterus. So mesometrium, mesovarium, mesosalpinx, these are the three different parts of the broad ligament. And the peritoneal covering of the uterus, that is called perimetrium. That is called the perimetrium, this peritoneal covering. And then the muscle of the uterus is called myometrium, and the inner lining, mucosal lining of the inner lining, epithelial lining of the uterine cavity is called the endometrium. And I mentioned that the cervix of the uterus projects inside the vagina. So vagina is the birth canal, and the cervix projects inside the vagina, and the vagina surrounds the cervix of the uterus. So the cervix of the uterus has a supravaginal part and it has a infravaginal part, and infravaginal part of the cervix of the uterus is this vagina surrounds the cervix of the uterus, and these spaces of the vagina, the circular shaped space surrounding the cervix of the vagina, they form the fornices of the vagina. We call this fornices of the vagina. Anteriorly, there is anterior fornix of the vagina, and posteriorly, this is the posterior fornix of the vagina. So vagina is the birth canal. Vagina is the birth canal. It lies behind the urinary bladder, in between the urinary bladder and the rectum. And vaginal orifice, you know that the vaginal orifice is within the vestibule of the vagina. The vestibule of the vagina is the space in between the two labia minora. And vestibule of the vagina has two orifices, the external urethral orifice and vaginal orifice. So, excuse me. So vagina is the birth canal, and it surrounds the cervix of the uterus, and so it surrounds the cervix of the uterus, and it forms the fornices of the vagina. There is anterior fornix of the vagina, this anterior space, posterior fornix of the vagina, and on each side laterally is the lateral fornix of the vagina. And see here, this is the peritoneal reflection again from the anteroabdominal wall over the uterus, and then from over the superior, it covers the superior surface of the urinary bladder, then it goes over the anterior side of the body and the fundus of the uterus, and posteriorly, see, the peritoneum goes all the way up to the posterior fornix of the vagina, and then it ascends in front of the rectum. And this space in between the posterior fornix of the vagina and the rectum is the recto-uterine pouch, or the pouch of Douglas. And this pouch of Douglas and or rectouterine pouch is the most deep part of the female peritoneal cavity. And any accumulation within the female peritoneal cavity will get accumulated in this space in the rectouterine pouch or pouch of Douglas. Even the ectopic pregnancy or abdominal pregnancy may occur in this rectouterine pouch or pouch of Douglas. And see the rectouterine pouch and the posterior fornix of the vagina. So from the inferior side, this is the posterior fornix of the vagina, and from the superior side, this is the rectouterine pouch. So only this thin piece of tissue is in between the rectouterine pouch and the posterior fornix of the vagina. So any infection can go through the vagina. If there is a perforation in this thin piece of tissue, it can go inside the peritoneal cavity, female peritoneal cavity. And see here, this is the broad ligament of the uterus, and the broad ligament of the uterus contains the ovaries on its posterior aspect. This is the posterior view. And see the vagina, it has the vaginal orifice in the vestibule of the vagina, and the pelvic diaphragm muscle, the levatorinae muscle, is attached on each side of the vagina, and this is the perineal membrane. So external orifice of the vagina is outside the perineal membrane in the superficial perineal pouch. The normal position of the uterus is anteverted and anteflexed. Anteversion means the long axis of the uterus is forming an angle with the long axis of the vagina. Normally, when the bladder, urinary bladder is empty, so see, this is the pubis, this is urinary bladder. So normal uterus, it lies over the urinary bladder. So when the urinary bladder is empty, the long axis of the uterus, it forms an angle with the long axis of the vagina. And this is called anteversion. And this is the angle of the anteversion. And also the uterus, it forms another angle in between the body and the cervix of the uterus. So see, the uterus has a bending or flexion in between the body and its cervix, and that is called the anteflexion. So normal position of the uterus is anteverted and anteflexed. But abnormally, uterus can be retroflexed, it can go backwards, or it can be retroverted. It's not anteverted, it's retroverted. And also after several childbirth, or if the support of the pelvic support of the uterus gets weaker after several childbirth, the uterus can get prolapse, and usually normally the uterus prolapse through the vagina. And this is a condition where you can see this is the prolapse uterus. And the pelvic support of the uterus is coming from, or it gets the uterus, normal position of the uterus is supported by the pelvic fascia, also the attachment of the pelvic diaphragm muscles, and also the perineal body, which is the central tendinous point of the perineum, that also gives support to the uterus. And pelvic diaphragm muscle is usually very thin, and if this support get weaker after several childbirth, uterus can get prolapse, and the prolapse uterus can coming out through the vagina, and that condition is very painful. So that's all for my first part of my lecture. So I will go over the main internal genital organs and urinary bladder and urethra on my second part. That is the end of the first part of this lecture. Thank you.